Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis S. Scott with What's Happening in Birmingham. Today I have the honor and pleasure of welcoming back Dr. Nadia Richardson. Second time back.
Yep, thank you for having me.
Great. So she's here today to tell us about this great upcoming event she's got coming up later on this month. Tell us about it.
Sure. So July is Minority Mental Health Awareness Month. In 2008, the U.S. Senate designated July as the B.B. Moore Campbell Minority Mental Health Awareness Month. And B.B. Moore Campbell was a journalist, author, and educator who received a lot of recognition for the way she explored mental illness in her various books. And so our organization, which is No More Martyrs, started to host in July the Minority Mental Health Awareness Summit. So this summit, 2019, will be our 4th annual summit.
All right, so this year's is at Birmingham Southern?
Yes, Birmingham Southern College.
And you got 2 days.
Yes, we will actually have pre-summit training for licensed mental health professionals on July 17th.
Okay.
And then the actual summit on the 18th.
All right, so who are some of the speakers for this year's summit?
So the exciting news is that we have Jasmine Pierre, and if anyone follows the news around minority mental health, she's received a lot of national recognition for developing The Safe Place, which is a mental health app specifically for minority mental health. So she's out of New Orleans. She's a phenomenal advocate. She talks very openly about her own experiences living with and managing mental health concerns. And so she'll be here to talk about her mental health app and what led her to develop the app. And we also have noted child psychiatrist Dr. Artie Nelson, who will be here as well.
All right. So one of the things I've noticed when I went on the website Eventbrite about it, that or the different races, but you're also doing different sexual orientations as well.
Sure, absolutely. So, and I know a lot of people, because they follow No More Martyrs, have a lot of questions about that, because No More Martyrs is a mental health awareness campaign that seeks to build a community of support for Black women and girls. But one of the things that we found when we started our organization in 2015 was that we developed allyship relationships with other organizations that were doing phenomenal mental health awareness in different communities. So Native American mental health, Asian, Hispanic, LGBTQIA. And we support each other virtually and in person at our various events. And when it came to July, there was not one large conference specifically designated to exploring minority mental health awareness. And so we developed this event as an organization that focuses on Black women and girls to have an open dialogue about minority mental health in general. So there are different speakers that are coming in who represent different ethnic, socioeconomic, ability, sexual orientation, gender and gender identity. Various forms of diversity are represented at the summit, and we explore how mental health manifests itself differently based on these diverse experiences.
All right. So have you learned from just having the open dialogue and the small group discussion, do you find people becoming more open and willing to talk about the issues?
Sure. There's ways of, because of those dialogues, we're able to explore ways of supporting each other. What does allyship really look like? What does it look like to be culturally responsive in the way we go about providing mental health services, but also outreach and education? And so it really has been, for me, very productive way of building relationships and also making sure that we're honing our services and mental health awareness in a way that's going to be applicable across multiple forms of identity difference.
All right, so what stigmas are you seeing now that, I guess, especially you all in that field, are trying to debunk about mental health? You know, I know one is always be, a lot of people don't want to go because they feel like, well, you know, people gonna think I'm crazy.
Oh, sure.
Or what are some other new myths now?
I mean, I had a conversation like that just today with a young person who was saying that their family didn't understand why they were going to see a counselor. So there is still a lot of stigma around, especially for, you know, us being in the Bible Belt in Alabama. You know, that you can pray it away.
Let Jesus fix it.
I mean, yes, go to church, if you were in your Bible more. And so really pushing away from that idea, pushing back against this idea that you can't have faith and pharmaceuticals, faith and your counseling sessions, faith and whatever else you might need to commit to a healthy a treatment plan in regards to your mental health concern. So really pushing back against this idea that it somehow characterizes you as being a weaker person, a lesser person, a less faith-driven person, and a greater understanding of the fact that it is actually just a medical condition, and there's biological, psychological, and very social factors that can contribute to someone being in mental distress, and that when we talk about mental health, we are in fact talking about health. So everyone should be aiming to be healthy, right? So we can talk about mental health in that same way, the same way we talk about exercise. You need to talk about your mental well-being.
Ken, in this day and age, and I guess we're in 2019, a lot of times people are afraid to go get help because they think cost is a factor. Is cost a factor in getting help anymore?
What we're finding is that a lot of individuals aren't even fully aware of what's covered in their insurance. That's number one. A lot of employees aren't familiar with the fact that it's a part of their employee benefit. So a lot of employees, depending on what company you're with, you also have free employee counseling sessions. Some of those sessions can be individual sessions, but they're also free counseling sessions for married couples or parents and children. So there's a lot of times those services are available. If they are not available, if there are barriers, whether they're financial, whether it's insurance, for whatever reasons, there are also community organizations that offer services for free or on a sliding scale. And there are organizations like No More Martyrs that will help you identify those resources should you need them.
All right, one alarming thing before we kind of did the interview was talking about was suicide rates among young Black youth.
Yes.
Can you speak more about that?
Yes. So the research that has been coming out has really taken note of the fact that the rate of suicide in Black youth is now twice that of their white peers and counterparts. And so the Congressional Black Caucus has taken note of that. Congresswoman Bonnie Watson Coleman has chaired now a task force that's addressing that on a national scale. As an organization that is founded and headquartered in Birmingham, Alabama, but is also a national organization, we are actually addressing that in a forum that's taking place also at Birmingham Southern College on July 17th. And a part of that forum is really drawing attention to the fact that there's this work being done nationally to address that rise of suicide. It's been classified now as a national emergency, a public health emergency. But we also want to pay particular attention to the fact that some of the most noted cases of loss in regards to Black youth and suicide have actually come from our state. Maddie and Mackenzie, who are two young 9-year-old girls out of Alabama, were lost to suicide. And most recently, Nigel, who was 15, who was lost in Huntsville, Alabama. And in all of those cases, their parents, their family, their friend, their school systems mentioned the impact that bullying had on their experiences. Also, issues related to medication, access to care, and identity. Whether it was a matter of coming out or being supported in their communities as LGBTQIA. So I wanted to really have that conversation in Alabama. It's an open, free conversation. Members of the community are able to join us, but specific invitations are being sent to all the health departments in the state, the school systems, mayor's offices, different universities, clergy, so we can have a action-oriented conversation about what we can do as a state to address this.
How is social media playing a factor in all this now?
Sure.
Especially around the younger teens.
I always like to say this about social media. There is research that absolutely says that, being consumed by social media, being consumed by comparisons that social media, kind of encourage people to make in regards to their lives and other people's lives. All of those things can contribute to a depression and anxiety, and certainly there's bullying that takes place on social media. On the flip side of that, No More Martyrs actually started as a Facebook page. So there are pockets of support, whether they're in Facebook groups or chat groups or different organizations that have safe spaces that are taking place in social media to combat that. So while social media can get a bad rap, there's also a lot of advocacy that's taking place within social media to provide safe spaces of support for that. And larger organizations like, for example, Facebook are taking note of that. So right now there is a method on Facebook that if someone in their post mentions something along the lines of suicide, they can now be flagged on social media, and Facebook can be notified so that they can intervene and kind of get in contact with that individual. So social media itself, different entities are paying attention to this.
All right, so this is your 4th year doing it. What One's name is think about this. What goals do you want to achieve this year that you haven't had the last couple of years?
I think some of our goals remain the same.
Okay.
One of the things is that we're very action oriented. We believe in having conversation and dialogue for the purpose of education, but also collaboration and partnership. And we have these moments during the summit that are called community conversations, where we commit ourselves to addressing a particular issue in our community. And this year, the topic of that community conversation is decriminalizing mental illness.
Okay.
So how can you support individuals who may be in some form of mental distress in a way where they don't end up in the criminal justice system? So we're having that conversation. It's very action oriented. Another goal is to make sure that we highlight the voices of individuals who live with mental health concerns. Because a lot of times when you have conferences, summits, you'll have all the licensed mental health professionals there. You'll have the social workers, psychiatrists, psychologists. But what's missing out of the room a lot of those times are individuals who know what it's like to wake up and live with a mental health concern, or care for someone who's living with a mental health concern. And there's so much value in that experience, in that perspective. And so our summit is a place where individuals who live with mental health concerns are actually given the platform to speak and share those experiences in a room full of licensed mental health professionals, so that we can learn from each other.
All right, so I'll be remiss, since we're talking about mental health, that people who are watching this video right now, what are two-part question? First question is, what are some signs, if somebody's watching this, if they know somebody, their loved one, a friend, they're on that edge of being, just in case y'all didn't watch the first video she did, was of being suicidal or deep depression.
Sure. I mean, obviously some of the big things are isolation, drastic changes in mood. Some of the more tangible things are if you have a loved one that seems to be getting rid of some of their prized possessions. So you go over to a friend's house and they're giving away books and jewelry and different things like that. And also to pay attention to what we mean by drastic changes in mood, because oftentimes suicide can come from having suffered through something for an extended amount of time, right? So someone who has been living with depression and anxiety, especially if it's not diagnosed and not being treated, has been managing that for such a long time that suicide, in a sense, is an escape. So when you talk about a change in mood, oftentimes when we say that could be a symptom, people think it's someone who's happy, who is now switched and they're very sad and somber. Sometimes it can be the opposite. It can be somebody who's very sad and somber, who's been very separate and isolated, who is now the opposite. They're happy, they seem relieved, they're outgoing. And it's because that mood can come, or that change in mood can come from the fact that they've kind of given into the idea that they won't be here tomorrow. They've made that decision and that they're at peace with that decision.
Okay, what about if somebody's watching it, but I'm going to do it from a different angle. They don't know that they're depressed or tilting towards that line.
Sure.
What could you kind of tell them, like, you may be, deeper into depression or thinking borderline suicidal and you don't know it?
And you don't know it? I mean, it could be that, I would say a lot of times, though, individuals have a certain sense that something's going on.
Okay.
And one of the things that I would say is, in regards to No More Martyrs, in this very church where we are today, St. John AME, we host monthly sister support meetups. Okay. And the purposes of those meetups is that individuals who think that they might be managing a mental health concern but have never been to a counselor and are a little apprehensive about seeing a counselor, or individuals who are diagnosed, or individuals who are caring for someone who's diagnosed, can come to a safe space and have a friendly conversation. We have dinner, we have, snacks and desserts, and there's always a licensed mental health professional here. And we have general conversation. And so in that way, it's almost normalizing the conversation around mental health. And so individuals who think and are not sure, but they know that something's going on, they know that they're sad. Again, I'm thinking about someone I spoke to today that said she woke up one day a few months ago and she just knew something was different. Her energy level was gone. She was sad. She was not able to focus at work. She started to isolate herself from friends. She didn't want to do the things that she often enjoyed in life, as far as hanging out with friends and family. These are all signs and symptoms that something might be going on. And if you are not sure, then a sister support meetup is a great place to kind of explore that and then be connected to services.
All right, so back to your event. Free?
Well, On the 17th,
okay,
the Forum on Suicide, the Rise of Suicide in Black Youth, is free and open to the public, and that'll be taking place at Birmingham Southern College. The pre-summit training that's open to licensed mental health professionals who can receive CEUs for that, there is a cost for that. And then there's also a cost for the actual summit on the 18th. And there's two different costs. There's a community cost for individuals who are generally just coming in from the community, and then there's another cost for licensed mental health professionals who will also receive CEUs on the 18th as well. I will say this, we have some phenomenal sponsors, and one of those sponsors is the Jefferson County Department of Health, and they are providing 25 scholarships for individuals who live with mental health concerns. So if you are someone who identify as living with a mental health concern, and you live in the Jefferson County area, then you're able to submit an application to us to receive a scholarship to attend the summit for free.
All right, so both men and women.
Oh, absolutely, absolutely.
I know a lot of people are about to say, I think it's just for women. No, it's for both.
No. This is for men and women, and for all races, all nationalities, all sexual orientations, all levels of class and ability. Everyone is welcome to this.
Okay, so for more information, where do they go?
For more information, you can go to www.nomoremartyrs.org. You can also follow us on Facebook, Instagram, Twitter, and LinkedIn. And if you really want some additional information, you can give us a call at 205-440-2837.
All right. Well, Nadia, thank you again for coming back on the podcast.
We got to
bring her back again. We can talk about more topics and everything.
We're passionate, so we love to have the opportunity to get this information
out. Well, thank you for putting this event on, and like you said, people, we really need this. And, if you need help, don't be afraid to ask for help, because we all need each other. That's all I can say. We all need each other. So, thank you again. And for more videos, please check out my website, what'shappenedbirmingham.com. And don't forget to subscribe to my YouTube channel. Thank you all again, and bye-bye.
Thank you.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.